Good afternoon, everybody, and welcome to today's webinar. This is Susan Ryan. I'm the Senior Director for the Greenhouse Project. I'm really excited. This is the first of a series of webinars that we will be doing this year. This one is really focused on cultural transformation. It's a pretty amazing topic, something that I think we are all really eager to develop high-quality environments where elders, or those residing in these places, are able to live, grow, and thrive. Before we get into today's session and I introduce our speakers, I want to remind everybody that you are in listen-only mode. That means everybody's phone has been muted. At the end of our broadcast, we're saving some time for you to be able to send questions to our panelists today, for them to take them at the end. So keep thinking as the presentation continues so that you're able to ask those questions at the end. So let me introduce today's speakers. I'm going to start with Marla DeVries. Marla is one of my esteemed colleagues here at the Greenhouse Project. Marla and I have worked together. We're going on our 8th year working together at the Greenhouse Project. And when I think about Marla's role, I kind of think of that role as being the keeper of the secret sauce. And that has everything to do with our education, our tools, and our resources. And Marla's high standards of excellence and her passion to really create curriculum that goes the distance to equip people for success is really commendable. But in addition to that, on her plate, Marla is responsible for organizing our conference that we held in Little Rock, Arkansas this year, May 18. She's passionate about cultural transformation and, more importantly than that, ongoing learning and growth. Paula is the Executive Director at Eddie Village Green at Everwick. And to me, my work with Paula is so exciting. Paula just emulates leadership, wise leadership that's willing to go the distance, to really embrace radical change and make it happen. And she's going to share a bit of her story on today's presentation. We're going to talk about sustaining change, cultural transformation, and really what does it take to make it stick, make change endure. And I can't think of two better people to talk about it than Marla and Paula. So I'm going to get out of the way. I'm going to turn it over to you, Marla, to kind of take us through today's session.
Thanks, Susan. And I'm having, on my end, a little bit of technology challenge. So I'm relying on Paula to advance my screen for me, or advance her screen with the slides. So I'm going to jump right into it. So Paula, if you can go to the next slide, which actually will then, I think, trigger.
Okay, so I'm having trouble advancing. Hang on one second. Let me see if I can. For some reason, my computer is not advancing it either, but hang on a minute. Okay, let's try it one more time.
There, yay.
Okay.
So, and as my boss has been fond of saying, blessed are the flexible, for they shall not be bent out of shape. So, Meg, if you could launch the first poll. So we like to make these interactive and an opportunity for you to give us some feedback. And since we're going to be talking about sustainability and making change stick, I have this first poll. So we'll see if Meg can launch that. There. So when it comes to sustaining change, how successful would you say is your organization? So choose one of those options, whether it's very successful, that you would give it a 10 out of 10, moderately, not very, or not successful at all. So I'll give you a minute to look at those and make your choice. All right, give you about 5 more seconds. Then I'm going to ask Meg to close out the the poll and we'll see what the results are. All right. So, not surprising that most people don't give their organizations a 10, but that the bulk of people said moderately successful, which I said was somewhere around a 5 to a 7. And no one said not successful at all. So that's the good news, and there looks like there is some room for improvement. So, Paul, if you could go to the next slide, which is the agenda.
A second. I just did it, and for some reason it's not when it...
Yep, it takes just a second, I think.
Okay.
Thanks. So, on the agenda today is really unpacking what sustainability is and why is it difficult and what can we do about that. We're going to be discussing model fidelity, or what we call model integrity, and the model that Greenhouse uses. Paula's going to share the experience at the Eddie Beverwick, and then we're going to talk about what are some lessons learned and what are some strategies that you can use to make change stick. And I'm going to go right back into another poll. So, Meg, if you could launch the next one, which really looks at what makes sustainability difficult. Why did not all of us say it's a 10 out of a 10, or even that we are moderately successful? So you can check all that apply here. So when you think about sustainability in an organization, would you say it's a lack of employee commitment, poor communication, lack of integration with work, a lack of management commitment, or that there's an insufficient measurement? Give you a couple more seconds, and then Meg, go ahead and close it out. All right, so survey says it looks like the top one is lack of management commitment, followed closely by poor communication or that lack of integration with work. So the day-to-day practices, and then followed by insufficient measurement, and then finally, lack of employee commitment, and then finally lack of insufficient measurement. So some of the research that I'm going to share is based on an organization called Achieve Forum, and they've done a number of studies on change management, and so those categories actually came from them. And what they found in their studies, similarly to ours, is they said the highest reason that was reported was that lack of management commitment, followed by an insufficient measurement, and then going down to employee commitment. So some similarities in terms of what they found and what you all reported. So Paula, I have a few slides that are animated, and this is one of them. So go ahead and click a couple more times until 3 numbers appear. Perfect. So what are these 3 numbers? So as we set the stage for understanding sustainability, I wanted to share a couple studies that were done. So there is a Harvard Business Review report called Cracking the Code of Change. And in it, they report that 70% of change initiatives fail, which is a pretty startling number. A lesser number, 33%, comes from the National Health Service in the UK. So that was looking at healthcare, and they said 33% of quality improvement projects are not sustained upon evaluation. So if you think about evaluation could be, post 6 months, post a year, they're saying a good third of them aren't sustained. And then that final number, 14%. So this is another Achieve Forum study that they've conducted at least twice, in 2009 and 2012. And it was an international study of business people in kind of middle management and executive roles. And they were seeking to understand what makes behavior stick. And so through these surveys, what they came to understand in both surveys was that only 14% of organizations reported being successful in making behavior stick. And that, in fact, 2/3 or 63% said they were either not effective at all or only somewhat effective. So what they identified is on the next slide, which is that there are 3 main phases of behavior change and then making behavior stick. So they categorize these into aligning, which is all about setting the vision, getting the buy-in, and having everyone go in the same direction. Equipping is giving the tools, the resources, the training to people in order for them to be able to live out the change and be successful. And then finally, all of the efforts around supporting and reinforcing the change, which they called sustaining. So what they did was ask the respondents to indicate, if you go to the next slide, how much they dedicated their organizational resources to each category. So if you click a few more times, you'll see here's the result. So on the left, organizations said, 20% of our resources are really towards that aligning and setting that vision. The bulk of resources were found to be in that equipping, and then 20% again in sustaining. And I've shared this study with a lot of organizations, and I've had them look at their own organization and say, what's true for you? And most often, it's something like this. If it's not this 20-60-20 split, most organizations would say the first 2 categories, aligning and equipping, is where they spend the bulk of their resources, and not as much in sustaining. And so if you click one more time, Paula, I think we'll get to the net out, which is when we look at the impact, so what our efforts really yield. This is what Achieve Forum found out, that we get just a 10% return on investment, if you will, in our equipping efforts when it comes to sustainability, and that it's much higher when we think of efforts in aligning or sustaining. So when I first saw this research, it was a real wake-up call for me, because I live my professional life in that middle category, in that equipping and equipping others and educating others. And so to hear that it really isn't having the impact that I hope was a little bit disheartening. And then I looked at, and this is research that actually goes back to 1885, if you've ever heard of Herman Ebbinghaus and his forgetting curve, which really talks about that within an hour, people will have forgotten an average of 50% of the information you presented. So I'm keeping that in mind today. And that within 24 hours, they forget on average 70% of information. And then it goes up to 90% within a week. So it's like adding water into a bucket that has a hole in the bottom. So it's not just about educating. We need to do more. It's not about providing less education, but it's really looking at what are those other things that can be done in terms of our aligning efforts and our sustaining efforts to really yield the greatest stickability. So go ahead and go to the next slide. I got one more piece of research. And what I found out, and this is true in what others have found, is that implementing change, there's been considerable research on what does it take to implement change. You could go to Cotter and Lewin and all of their different stages of change, but collectively there's been little research carried out on the issue of sustainability. And one of the researchers, Buchanan, argued that it was really, part of it was due to just the expense of a longitudinal research and being able to look at sustainability over time. So what Buchanan and his team did was review the available evidence on sustainability, and they identified 11 main factors that affect sustainability, and 3 in particular that have significance in sustaining change. And I don't want to get too in the weeds here, but we'll revisit these at the end. So the 3 were the substance of the change. So whether or not the change is central to the organization and it was agreeable to the stakeholders or employees, versus if it was kind of what was seen as a peripheral issue or even a threat to the vested interest of the stakeholders. So how much does it relate to what the heart of who we are as an organization? That's the substance. The second factor was what he called processual, or the process. So what was the implementation process itself? How was the change managed and carried out? And that can include how stakeholders were engaged and involved in the process, which makes me think of that adage that, people don't resist change, or they resist change far less if they're a part of the change. And then finally, the temporal side of it, which is looking at what was the time given for the change to occur. So what was the sequencing of it? What was the pacing of it? And I like to think about this as the kind of the Goldilocks philosophy, not too much, not too little, or in this case, not too rushed so that there isn't time to adapt, or not too delayed, but there's a lack of urgency, but really finding out kind of that just right approach. So if you Google the process of sustainability in context, you'll find a graphic like this, and that might be a good reminder for you. And one of the takeaways, if you go to the next slide, from Buchanan is this statement, which I think is important for us to consider. So it says sustainability is a process to be managed, not a condition to be achieved. And as I was preparing for this webinar, I did a Google search on the definition of sustainability, because I put in the agenda, what is sustainability? And uniformly, I found the definitions really spoke to that sustainability is the process of supporting something or keeping it going. Some dictionaries use the term, it's about nourishing something. And all of the definitions, when they talk about sustaining, use active verbs to describe it. Oxford Dictionary says to sustain is to provide enough of what somebody or something needs in order for it to live or exist. And I would push that even further to say it's not just about living or existing when we think about change, but what we want is to thrive in the change. So the bottom line is that sustainability requires effort and intention. And so even though if you go to the next slide, this might be a common thought, but it is hardly ever true. What if we don't change at all and something magical happens? Wouldn't that be nice? But sustainability requires action and intention, and really understanding it's not an event, it's a process. So if you go to the next slide, that idea of effort and intention was reinforced by the Thrive Research Collaborative and Barbara Bowers, who was tackling the issue of sustainability in greenhouse homes. And her research on sustainability in long-term care, she did a search on articles and what has been done, and she found the same thing, is that there was far more research done in long-term care on implementing than on sustaining. So Barb's qualitative research looked at several elements of the greenhouse model, including decision-making, and the statement that you see on the slide is one of her conclusions, and I would say it's really become a mantra among greenhouse organizations, that the model gets reinforced or eroded one decision at a time. So looking at those smaller elements becomes really important. So let's get into what merit is. So merit is the model enrichment resource and integrity tool. It's a multi-stakeholder assessment measuring how well the greenhouse core values, real home, meaningful life, and empowered staff get lived out in daily life in greenhouse homes. I think if you click once, Paula, you'll get that statement. So if you're unfamiliar with greenhouse, the core values are our guiding pillars. So real home focuses on the built environment, but it's also the systems and the practices that support what you and I would consider a real home and not just a home-like environment. And then meaningful life addresses the philosophical shift that occurs from an organization rooted in task completion to one in which then the elders are put in the driver's seat. And then finally, empowered staff, the third core value, some would arguably say is the most vital and complex of the core values, and it looks at the radical organizational redesign and how these new roles and responsibilities work together to support the elders. So I started this out saying it's a multi-stakeholder assessment. So multi-stakeholder means that all those who work in greenhouse homes or support the operation of the homes participate in the assessment. So let's go on. I've got another poll. So if you could launch the next poll, and this really gets at how do you as an organization, your organization, how do you use assessments? So I put a few options. You can, again, I think select all that apply. You use an outside source. You focus on satisfaction surveys. You have your own. If we've got any from the Greenhouse Peer Network, or you don't use any. All right, I'll go ahead and close it out. And okay, so interestingly, we find that a real mix. So 66% use some kind of satisfaction survey. Almost 30% are using an outside source. And then even split of people that have created their own or don't do any. So interesting results. So let me share more of the Greenhouse Merit Staff Assessment. So first, I think it's important to say why did we create something like this? And first and foremost, it was to help organizations that were part of our Greenhouse Network to really protect their investment. They've invested in adopting this philosophy, in building these homes, and we want that name and that philosophy to mean something. We also wanted to give them a tool to promote the ongoing learning and growth in their homes. And as we said, it's a process. It's not you arrive and you're done, but to give them a mechanism in which they could evaluate themselves and then learn and grow and improve. It also was an opportunity for us to look at what's happening across the peer network. So this gets at kind of aspects 3 and 4, to understand what's going across the trends in the peer network, but then also to leverage that experience. So to look at one organization is doing really well in this area, what can we learn from them to the benefit of others in the network? So that's the why. Now I'm going to go through the historical timeline, and there's a lot of information on this slide, and I will keep it brief. But we started down this path back in 2012 and 13, and a work group was established to really look at how do we protect this investment? We have these 3 core values. How do we really measure? And so we had a series of phone calls from those that were practicing in active greenhouse homes, and we just very methodically explored, what does it mean? What are those essential elements of each core value? What do they look like? How would we measure? And then from that, we moved on in 2014 to have a pilot survey. So we had 4 pilot sites that agreed to take part in this survey. It was a survey full of a lot of open-ended, curious questions. We asked them to submit stories and to share really how it got lived out. And we encouraged them to have a group process. So they would fill out this survey together. And we presented those findings at a Greenhouse annual conference. And then we regrouped. And one of the significant partnerships that we established was in 2015 with the Center for Social Research at Kelvin University. And CSR, as they're known, has been around for 50 years now, initially to assist research projects for the college, but then they've expanded to become an independent center. And what they do is really innovative social scientific research. And then assist organizations with reporting, with statistical analysis. And so they've really helped us to create the vehicle beyond us sending a document that people can fill out to really having the sophisticated online system. And so we launched in 2015 an online version of the merit assessment. And then in 16 and 17, we again continued to learn and grow and regrouped and did significant revisions. And one of the revisions was around how we got the stakeholders to participate. And I won't bore you with those details, but when I show you the numbers, you'll see that we had a drastic increase in participation from 15 to 16. We also did a significant revision in terms of just looking at the questions and how the questions were formulated in terms of the reading level and really making sure that they made sense to people. And then to move on to the 5th aspect, in 2018 and 19, we really focused on making the resources as effective as possible so that greenhouse organizations could use the results and really have that sustainability plan going forward. So I'm going to go on to what merit is. What does it look like? And I'm going to start at the bottom of this diagram and go up because in its most simple form, it's about 94 questions that are in an online portal that are related to different elements of the model. Now, those 94 questions are all funneled up to 9 different subscales. So you see those listed on the right, and they are looking at different elements of the greenhouse model. So how the built environment is part of residential life and how that gets lived out. And then going down to elder well-being and autonomy, and then educational support. There are individual questions that relate to those subscales. And those subscales are a part of the 4 primary scales, which are the 3 core values: real home, meaningful life, empowered staff. And then a 4th element we call model support, which really looks at how well is the organization supporting the sustainability in terms of education and in terms of the leaders being on board. So merit is a 5-point scale. And when somebody goes in and takes the assessment, they are given the options which go from definitely true down to definitely untrue. So a perfect score would be a 5.0. And as I get into some of these results, when an organization gets their results report, they are getting an overall merit score, the subscale scores, the 4 scales, the 9 subscales, and then the individual questions. So it is a comprehensive system. So let's go to some of the numbers when it comes to participation. So as I mentioned, we officially launched using CSR as our resource in 2015 with 212 participants. And you can see how we have grown and been pretty consistent the last couple years. You also see the number of organizations within the Greenhouse Peer Network that have participated. And then I said it was a multi-stakeholder assessment, meaning all those who work in or support the homes participate. And so I just teased out a couple specific examples of the nurses, the number of nurses that have participated each year, since they have a very vital and daily role in the greenhouse homes. And then the Shabazim, who are our direct care workers in the greenhouse model, and the number of participants that we've had each year. But additionally, there are the C-suite leaders, clinical support team members, and others that participate. So go on, and I'm mindful of time, and there's so much information that I want to make sure that we give Paula enough time. So this slide simply shows the data that we have and that we provide as part of that, the desire to really support organizations to use their results to sustain change. I'm going to actually forego the next poll just so that I can get to some of the data. So this is a lot of information to absorb, and so I'll go through it quickly just so you can get a flavor. So this slide shows the overall merit score for all greenhouse organizations. That's the three columns on the left. And then the scores for the last 3 years for the scale in the 4 scales that we have. And so what you can see is that each year we're trending up, and remember 5 is that perfect score. As we go to the next slide, we're drilling down to that subscale layer. And so this is the first of the 2 slides. So if you click, I think you're going to see that our highest subscale continues each year to be elder well-being and autonomy. And that really looks at how well elders are in a greenhouse home, are able to exercise control and choice in day-to-day activities. And then going to the next slide, these are the remaining subscales. And what you see is that consistently a collaborative coaching culture, which is part of empowered staff, has been our greatest opportunity, or our lowest subscale. And this subscale really looks at the vital nurse and Shabazz relationship in the presence of a coaching culture. And while it's the lowest, if you click one more time, Paula, what you'll see is that it actually has experienced the most significant increase from 2017 to 2019. So I think it was a 0.27 increase over the 2 years. Just a couple more slides that I will highlight. We have leveraged the research that Barb Bowers has conducted, and in the past couple years, I think it was in 2017, we added questions specifically looking at decision making in this instance, and then also the nurse-Shabazz relationship. And so really looking at knowing that the greenhouse model gets reinforced or eroded one decision at a time, we wanted to look at how do decisions happen. And so the goal, might not surprise you as you look at the different terms here, is for a coached collaborative decision making. And so you see the results over the 3 years is that we've been pretty consistent in terms of what decision making, day-to-day decision making looks like in greenhouse homes. And then the next slide looks at the relationship between the nurses and the Shabazim, the hands-on care partners. And our goal here, and again, this is based on Barb Bowers' research, our goal here is for an integrated relationship. And I'm happy to see that we continue to trend up in terms of integration, and that what the data shows is that nurses and Shabazim are increasingly working together rather than having more of that traditional nurses tell Shabazim or tell CNAs what to do kind of a relationship. So go ahead and go on to the next slide. So here's just a sample of some of the individual questions that are found in the merit report, the merit assessment, and you'll see some of the changes, the growth that's happened over the past couple of years. So if you go to the next slide, I know that was a quick and broad overview of merit, but I thought that I would listen to the advice of one of the Lannisters, if there are any Game of Thrones fans, and let you hear a story of one organization's merit journey. So I'm going to turn it over to Paula to share her experience.
Great. Thanks, Marla. So a lot of what Marla talked about, too, is just going to be reinforced by what some of our results were, but I'll give you a little background on Eddy Village Green Beverwyck. So we're a campus in upstate New York, and it consists of 201 independent senior living apartments, 41 enriched housing, which is a form of assisted living in New York State. They have different classifications. And then we have 2 houses with 12 elders in each house. So Beverwyck was built, so we're similar to a CCRC, but we're not licensed as a CCRC. And Beverwyck was built in multiple phases, with the nursing home being the last, the 2 houses being built there. So when they were built in 2011, they were to be modeled after greenhouses. So in the Albany area, we have another campus that has 16 greenhouses on their campus, and the houses, and they're also part of our system. And our houses were built to be modeled after them. They were not opened as greenhouses, but the physical layout was similar to the greenhouses that we already had in the area. So it was always the intent that they would be, and then they never were. And we had different reasons for that. And then when we had a person come onto this campus at Beverwyck, he was the administrator of the other greenhouse within our system. So he tried to implement a little bit of piecemeal greenhouse things, and it really ultimately was not successful. So in 2017, he contacted the Greenhouse Project, and they came on. They did an initial merit assessment, which we'll see the results of to give us our baseline. And then we really worked through the whole process and getting all of our staff educated and working through the process, which took us about 1.5 years. So we have merit results from 2017 and then again in 2019. So those are the 2 things that we'll compare. So the first slide, you can see where we went from 2017 to 2019. And then here, so this is our baseline compared to Greenhouse Project, all the other homes. So then in 2017, a lot of this was not a surprise because we really weren't living the model, and the staff really didn't understand the why behind the greenhouse and didn't have that education. So these are our scores for our real home, meaningful life, empowered staff, and our model support. So when I say our physical environment it was designed that way, so we didn't really have that challenge where we had new construction. So our real home score was one of the higher ones, which we kind of expected, and it was the empowered staff piece that was the lowest. And again, it wasn't a surprise, and we kind of expected that because that part of the model was not being lived out day to day. And again, this breaks out just some of those subscales. So the convivium at mealtime, again, we were doing that. We were doing that in the house. We had a bit of a hybrid happening. But again, when we really drilled down, we drilled down into all of these areas, and there were some big processes of change that we could implement to improve. And we'll see our 2019 results as we go on. And again, looking at some of these subscales, collaborative coaching culture, organizational design. So again, not a surprise that we were scoring lower than other greenhouses that were active and up and running. So what we did, so We did have, like I said, we had everybody go through core training. We had a leadership strategic action planning where we could align our culture, our greenhouse model, and we were really looking at changing systems. So even if at the beginning, we thought, oh, real home, this looks like a home for our elders, there was still a lot that we had to change to truly make it real home. So the biggest push was really the education. And also at the same time, we did have some leadership changes. So I mentioned we had somebody come onto our campus. When we started with Greenhouse, I was newly hired. I think it was my very first week here at Beverwyck, and we signed the contract probably within that first week. So I was a new administrator. In the process, we also had a new director of nursing, which I think was a very positive change, because sometimes as you're making those changes, a change in personnel is not necessarily a bad thing, because it's a fresh start. You don't have people saying, this is the way it's always been. Why do we have to change it? So we had some fresh perspectives coming in at the same time. So this really talks about these some of those specific questions that Marla had on there. So when I talk about big changes and little changes, so real home, looking at that, this was one of the things we focused on, was a welcoming process. And as you go through implementing the greenhouse model, that it's really, you're looking at all of these things and drilling down. So the welcoming process for new elders was one that was a purposeful change, and it's good to see the change from 2017 to 2019, because we really did change that process. Bed and chair alarms, that was a big focus that we had, and a specific goal that we were working on. Meaningful life, so elders eating snacks and meals whenever they want. It was, we always had the kitchens in the houses, but it wasn't, the staff would not allow the elders, would not allow the families into the kitchens. They felt it wasn't safe. So it was just around the education and questioning, why can't we do that? There's no reason that this can't happen each day. Choice in showers or bath, that was something that we focused on too. And then the time and choice are the two things that we really were trying to focus on. That where in a traditional nursing home, you see it just, they fall into the slot of the person that was there in that room prior. So that was a practice that was in place here, and something we needed to work on. So the empowered staff, that's where we had the most work to do and where we saw the most changes. So this is, rewarding to see this. So again, this goes on to the specific questions, but it really shows that the staff now have a voice. Or I don't think they necessarily, I think they had the voice, but didn't feel like they had the authority. So this shows some really positive changes with the empowered staff. And when we look at our 2017 to 2019 results, that's where we saw the biggest changes. And again, this just really talks about the empowered staff. And really the biggest change that we made with the empowered staff was the core education, but it was also assigning coordinator roles. So that's a key part of the model. And once we started doing that, the staff kind of embraced that, and it did give them the voice, it gave them the resources, and it gave them the tools. So once we started implementing that, we definitely saw some positive changes around that. We also, with the empowered staff, we did, in the beginning and throughout the process, we did have some turnover, because sometimes the assumption is everybody wants to be empowered, and that's not necessarily true. We didn't really find that to be. And that's okay. It's not that they were bad CNAs. It was just that this wasn't the right model for them. So we did experience a little bit of that, but certainly we worked through that. So this compares our 2017 to our 2019 results. So like I said, empowered staff was the biggest jump. And again, that's what we expected to see, but in all areas, we had some movement, because we had some improvement to make in all those areas, and some processes to change. And going into the subscales, you'll see more of the same. So, and it was really, some of the changes were little, some of the changes were very big. And again, more with the empowered staff, you see some of those biggest jumps, and those were some of the biggest changes and in the processes that we made. So these last two slides really talk about our coached collaborative and the integrated model. So these two slides really, from a management perspective, are what I'm most proud of in seeing the changes between 2017 and 2019. And again, when we had the initial results in 2017, it wasn't a surprise because as the administrator, I knew that's the way that things were being managed. But to see that change in 2019, I know that the clinical support team really works very hard to make sure that we are having an integrated model and a coached collaborative. So it was nice to see those results and to see that the staff really do feel that it's happening and it's more than just lip service that we're providing. So with the integrated model, this slide as well, I think it was very positive to see where we went. And again, when we took it in 2017, it wasn't a surprise. But with the integrated model, when we first implemented coordinator roles and we were going through the change, we did have a little bit of, it's kind of like a pendulum where you have, where the Shabazz in the house were thinking, I don't have to listen to nurses. The nurses were thinking, oh, I don't manage the Shabazz anymore. So it was kind of a pendulum that we had, and it shifted back. But an example of this was Shabazz break times, and it was an issue that came up in the house where they felt they didn't need to report to the nurse when they were taking their break times. And throughout the house, they can manage that and manage when people should be going on break, but it's just one of these common courtesies, communication that you talk with your staff. So it's just little examples like that. Or when, when we were having some struggles, it would be the Shabazz would communicate with the guide and the nurses would communicate with the guide and not communicating with each other. So really, I just think it's just a pendulum that shifts weekly. And sometimes, we're constantly working on that. But I think for the most part, this is an accurate reflection of how it works day to day. Obviously, I'd like to see more of that integrated. I'd like to see that number continue to go up. And going forward, really, with sustainability, I think some key takeaways that we have from Merit is really we need to continue to educate. So obviously between 2017 and 2019, we had a huge push where we were educating all the staff and a huge commitment. So we need to keep that commitment going because we did have that initial push, and make sure that we're sustaining with our current staff and with new staff coming in, that they're really understanding. Because I think one of the first things that Marla said is, people are less resistant of change if they're part of it. So, they really have to understand the why behind what we're doing each day. And I think, I think Marla said it twice too, but it also comes down to the day-to-day. It's not a one and done. It's not, we've sent everybody through core training and now we're done and we can relax. It's the decisions that we make every single day. They either reinforce the model or they erode the model. So it could be a decision, that's made by a housekeeper, or it could be a decision that's made by an executive, in a C-suite. So all of these decisions in combination do make a difference. And that's the part that we really have to, everybody has to work on. It's just that day to day. And so really, we're looking forward to, Merit next year to see that sustainability, because seeing the results that we had, we would expect to see a jump because we really did have that big focus and that big push. But as we go through this next year, that sustainability is going to be key.
Awesome. Wow. It's so, I've seen these results, but just to hear you talk and just see the visualization of them, it's so impressive. So thank you, Paula. I've just a couple slides to kind of wrap things up and hopefully leave a couple minutes for questions. So some of the lessons that we've learned along the way is, first of all, around messaging. Merit is not a grading system or a rating tool. It's really about seeking honest feedback. And I like actually shifting. I've been using that term assessment, but I really think it's about creating that feedback loop and becoming a culture, a feedback culture. So Merit is a feedback tool to learning what the employees see as going on, the good, the great, and then the not so great. It's also important and not always easy to move beyond a focus of participation. So whether it is a satisfaction survey or a survey you've created yourself, or you're using an external organization, sometimes the push is just getting people to take the assessment, which is no small feat. But really moving beyond that to taking action and doing something with the results. Because remember, as we said, to sustain requires action, intention, and that nourishment. And that the 3-year look back period is helpful for organizations. So Beverwyck only has the benefit of 2 years because they've only taken the assessment twice. But we added that in later years because we wanted, while peer comparisons are great, how do we compare to the Greenhouse peer network? If we want learning and growth, it's, I would say, probably more impactful to know, are we an individual organization? Are we making forward movement based on, are we better today than we were yesterday? Because that's kind of the journey that we're all on. And then finally, as we look at the busyness that we have in long-term care, as much as possible, we need to integrate this into existing processes. And so many sites are finding success in using Merit as a QAPI tool. And then next, just a good reminder, we have this learning framework, which I say is also a sustainability framework. And it's something that you can use to make change happen and make change stick. And it's that whole idea of beliefs, behaviors, and systems that it's oftentimes when we think about a change, we reduce it down to, well, you have to start doing this or you have to stop doing that. And that's what I would label as behaviors. But changing behaviors is really only one part of the equation when it comes to learning and when it comes to sustainability. We have to also look at the underlying beliefs, what our mindsets are, what our attitudes are, because those shape our behaviors. And then in addition to that, not just our behaviors and our beliefs, but we have to look at the organizational systems. So, Deming, there's a famous Deming quote that says, a bad system will beat a good person every time. So we've got to look at, are our systems aligned with what we want, what our expectations are for our staff and the beliefs that we hold true. Because if there is an inconsistency in these three, the system will win every time. So the next slide just emphasizes that, which is a good system shortens the road to the goal. The road to the goal. And then some final takeaways. And I don't have the official research article to back this up, but this has certainly been my experience. When using multi-stakeholder assessments as a feedback tool, there are benefits for sustaining change that I think are beyond the numbers or beyond the percentage change. And it goes back to what we started talking about, were those 3 Buchanan factors for sustaining change. An assessment tool is about engagement, and each person's involvement matters. It's hearing the voice of the stakeholders, and it's an empowering action. And that really fits with what Buchanan talked about, that it's the manner in which people are engaged in the process. Secondly, a good feedback tool is educational. The model with Merit, the model is clearly described in each question. And it might provoke people to think, oh, I didn't know that was part of the model, or why isn't that practice happening more as part of the model? So it really helps people to read that, to see that, to create greater understanding. It's that subtle reminder of what are the elements of the model. Thirdly, it's really a unifying tool. So it connects those day-to-day practices with those overarching philosophical ideas. It also helps to combat well, we're already doing this. And it speaks to that substantiality that Buchanan talked about. It's not an added something, it's really connected to our overall vision. And then finally, a good assessment tool, particularly when the results are shared among the team, is a vehicle to identify and celebrate successes. So it really speaks to, again, that pacing and that timing. It's important to not forget to stop and celebrate the successes. So I'm going to turn it over. If there are questions in the 3 minutes that are remaining, it's a lot of information in a short amount of time.
Marla, we've got some questions, so I'm going to go as quickly as we can. What was done to increase stakeholder participation in the merit survey?
So where we saw the biggest jump between 2015 and 16 is we changed our process. We had a panel process, which was we relied on organizations to provide us email addresses, and then we directly emailed people to let them know that there's a survey, and then we could track. We shifted gears to say it's more about just distributing a link to as many people as possible. So that's why there was a big jump. I would also say it's no small effort we do a lot of promotion. We give resources to organizations about what they can do to promote. Some set up a lab, a computer lab, giving people time. And I would say also just setting the expectation that this is something that we expect you to do because we value your feedback. So all of those are little tips for growing participation.
Okay, another quick question. Do you have a similar tool for residents and families?
So at this time, we don't have a specific tool like that. And that's not, I've had this question before. And so this tool, because it gets into a lot of the nitty gritty of organizational practices, of which families and elders wouldn't necessarily know the answer to. We do, though, add SAGEs. SAGEs are our volunteers that are from the community, that are the wise leaders that support the self-managed work team. We have included them, but at this point, we don't have a similar mechanism for families or elders.
All right, well, I just want to thank both you and Paula for sharing everything that you have just shared. It was spectacular and really appreciate your time. I'll have you just advance some slides and let everybody know that you will get a copy, a link to this webinar sometime this week that should have those slides and the recording of this. Some things to kind of let you know. We do have a webinar next week. Dr. Al Power is going to be doing a webinar on Beyond Antipsychotics and Non-Pharmacological Interventions, a Well-Being Approach. That's January 14th at 3 p.m. I'm going to invite you, given that it's the top of the hour, to visit our website where you will find information about our dementia symposium that we were doing in Little Rock on Monday, May 18th, as well as the Greenhouse Workshop, 7 states, 2 countries. All of the 2020 webinar series, we've got several webinars that are drilling down into deep cultural transformation, making a business case for Greenhouse, as well as our dementia series, and of course, workforce is so vitally important. I am so thankful, Marla and Paul, for your incredible presentation today, and really thankful to all of you who participated by attending. We appreciate your questions, your comments, and please feel free to reach out to us if you have additional questions. Thanks so much for sharing part of your afternoon with us. Take care.